Welcome. My name is Brian Murphy. I'm a Shine counselor. I share Millis with Jane Dewey. If you guys have come down before, there are two of us that service this location. So what I'm going to do is I'm going to take you through sort of a broad brush at Medicare. I know you probably all have very specific questions, but hopefully in the broad brush that I take, I will deal with some of your questions or, follow up. Either with questions today or we can do a one-on-one at some other time. So what is Shine? Shine is serving health insurance needs of everyone for Medicare. We've all been trained. There are about 600 or 700 of us in Massachusetts. We work out of senior centers or council on aging. And if you have a discussion with anybody, the same function exists in every state and territory in the United States, but it may be called something different. So if you're talking to a friend in Rhode Island, it might be called SHIP, S-H-I-P. So here are some of the topics that I would like to cover. And these are based upon the kind of phone calls I get from beneficiaries when I'm dealing with people out of HESCO down in Sharon. What is it? Eligibility, working beyond 65, which is very common. Penalties, costs, public benefits. People call up and ask about assistance. So I'm just going to take a broad touch at all of these subjects. But again, you may want to go into more detail than we have time to speak today. So hopefully with what I've just suggested, this might be consistent with what you're hoping to hear, at least some of the topics. So what is Medicare? So this is motherhood and apple pie slide. But for people coming off group insurance, this is quite a shock. You're going through all these parts, A, B, C, and D. So A covers hospital insurance. B covers the doctors and the tests. D is a more recent requirement. In 2006, it's for drug coverage. So who is eligible? 65 years or older and you're a lawful permanent resident for at least 5 years. There are people with disability under 65 that may qualify. Most people get Part A for free because they've worked for 10 years or 40 quarters, and it's either through and paid Medicare taxes, and it's either through their own work history or their spouse's or ex-spouse's work that qualifies them. And this is one thing I'm saying for people that just signed up now. Separate Social Security from Medicare. Medicare is 65. Social Security, as you know now, to get 100% of your benefit, it's 66 and 2 years, and that's going to continue to change. Medicare is 65. How do you enroll? For A and B, you go to Social Security. So right now, they're not meeting people in person, so you would either do it on the computer or you call up and you make an appointment and they'll wind up calling you back. In normal times, you could go, by the way, if everyone here is from Millis, the Social Security office for us is in Norwood. If you're not receiving Social Security benefits, you have to sign up. If you're already on Social Security, like you went on at 62 or something like that, they will automatically send you your card when you're eligible. This is pretty confusing. I don't know if any of you have gotten trapped in any of this yet, but I want to go through some of these. Your initial enrollment period, my next slide goes into that in some detail. Special enrollment period, and I'm going to talk about one situation that many people will qualify for. General enrollment period, and then if you're already on Medicare, and when I talk to people on the phone, a lot of times they're afraid of what they're going to choose because they're afraid if they make a certain decision, they're stuck with it forever. No, you're not. There's an annual open enrollment period, which we're in right now, from October 15th to December 7th, and you can change which you're on, and that would become effective January 1st. There's a Medicare Advantage plan open enrollment. I'm only going to mention that here on this slide. If you're on a Medicare Advantage plan, January 1st, there's an open enrollment period from beginning of January to the end of March. And if you make a change, the change becomes effective July 1st. That's not open to everyone. It's only Medicare Advantage. And what changes can you make? You can change from one Medicare Advantage plan to another. Or you can leave Medicare Advantage and go back to Medigap in a drug plan. But it doesn't go the other way around. If you're on Medigap or supplement plan, you have to make your changes during the open enrollment period, which is now. It's confusing. I understand. Am I going too fast? Okay, so far? This is details about your initial enrollment period. I think people have heard about it. It's a 7-month period. 3 months before the month of your birth, the month of your birth, and 3 months after. Reason why I'm put this much detail up on this slide was I don't want to see anybody not covered by their mistake. So this individual was born on July 15th. The day isn't important, it's the month. 3 months before, if you sign up April, May, or June, you would be active on Medicare on July 1st. If you sign up in July, the month of your birth, it would be a month later. August, it's 2 months later, and so forth. And again, the only reason I'm putting this up is be aware of when you pull the trigger and when you would be actively enrolled.
Is that an exception when you're still working?
So are you working beyond 65?
Yeah.
I'm there in 1 or 2 slides.
Oh, okay. So
Okay?
that's different than this right here.
That is correct. So this is your initial enrollment period only. It was the next slide. So if you work beyond 65, which is very common today, there's 2 kinds of situations. One situation would be if you're in a group, if you're in a company with more than 20 people in their group employment plan. You don't have to do anything. You can, just keep working. You got to be a current employee. It can't be COBRA. It can't be retiree. You can delay until you retire. Yes?
Can it be a spouse's plan?
Can it be
A spouse's spouse?
Yes, and that's, I think, the very next slide.
Oh, sorry.
Because these are things that really trip people up, so I want to go over these. When you retire, that opens up a special enrollment period. You have 8 months in which to enroll. If you're on an HSA, is anybody here on an HSA? Okay. You don't want to do anything. So a lot of people immediately want to sign up for Part A when they turn 65 because Part A is free for most people if you've worked for 10 years. When you're on an HSA, from the time you sign up for any part of Medicare, you cannot have contributed to the HSA for 6 months prior. You're shaking your head. You're familiar with this?
I've heard something like that, yeah. So it's helpful to hear what you're saying.
So if you are on a plan, my recommendation would be, if you see yourself retiring a year from now, you should look at, can you accelerate your contributions in the first 6 months of next year and then shut it off by July 1st if you're going to retire in January. And usually when you're doing pre-tax contributions, your company will let you fluctuate. A different situation is if you work for a small company with 20 or fewer employees, you must go on Medicare in your open enrollment period because there are rules of who pays first, Medicare or your group insurance plan.
I do have a question about when you retire and you have 8 months to enroll in Medicare, but you still want, when you retire, you want to have coverage right away. So I'm not sure I understand the 8 months to enroll.
I'm going to answer that two ways. There are rules, and that's the rules. You still are able to retire. You are still able to enroll, I should say that. But I agree with you. I think the point of your question is you don't want to miss a day of coverage.
Right.
So the point would be, if you know you're going to retire in January, I would tell you to go to Medicare, go to Social Security rather, 2 or 3 months before that time period and tell them, I want to start to be covered January 1st, if that's, when you want to be covered. I'm going to use the example of where I recently saved a friend of mine from getting into a penalty situation. That's another slide or two out. Okay, so for small employers, you go on Medicare and they have rules of who pays first. So if you're married, the same rules apply. If it's your spouse, you're on your spouse's group plan, which lots of people are. You go with one insurance company or the other. There's no need to do anything because you're on your spouse's group insurance plan. When your spouse retires, it creates that same 8-month period for you to sign up, that special enrollment period. In all cases, so you're beyond 65, I assume. So you must submit a form. If you're beyond your initial enrollment period, you need to submit that CMS form 564, and it's just proof of coverage, because otherwise you would be in a penalty situation. I could get you that form, you can find it easily, and Social Security sees tons of these because people work beyond 65. So here's my example. I'm saying avoid penalties, and I'm going to use a friend of mine, a guy from Waters. He calls me up around Christmas time. We're catching up in old times. He is 66, his wife is 63. He didn't sign up in the initial enrollment period because he's covered under his wife's plan. He tells me in the phone conversation that his wife is a teacher. She retired in October of last year. She was concerned about COVID and, maybe getting something from the kids. And we talked through a little bit, and I said, oh, so what are you doing for insurance? And he goes, I'm on my wife's plan. She is now on retirement insurance. That's not group insurance. There's no active employee. So he didn't realize he was 3 months into his 8-month special enrollment period. Had we not had that casual conversation, he potentially was going to go towards a penalty situation. If he hadn't sort of, gone on Medicare based on our conversation, your next opportunity would be the general enrollment period from January to March, in which case you would be on Medicare in July. And in his situation, if he had waited much longer, he would have been in a penalty situation. It's 10% per year for missing Part B. And that's 10% of whatever Part B costs that year, and that goes on for the rest of your life. It's also 1% per month beyond 2 months for Part D. Now, in his situation, in his wife's retirement insurance, he had drug coverage, so he wasn't in a penalty situation. But had he not signed up within 5 months, he would have gotten himself into trouble for Part B. So we briefly touched on what is it? Eligibility, working beyond 65, and I just say have a date. Don't get caught blind like my friend. It was just a casual conversation. What does it cost? So the one thing that I wanted to know, and I'm sure you do too, is so you're coming from your group insurance and you're kind of used to the lay of the land. It usually goes up a few bucks a year and there's some changes. But now you enter Medicare. What the heck does Medicare cost? So I'm going to touch on that. Remember, Medicare is individual insurance. We all came from, if we had group plans, I gotta remember not to touch that. We all came from group plans, so whatever the insurance was, we both had if you're married. But these are individual insurance, and if you have different health needs, what's right for one may not be right for the other, so you should look at it on an individual basis. Both plans don't need to be the same. So to give you an idea on costs, Medicare is not free. Part A is free, but there's a hospital deductible of $1,484 per period. This doesn't cover physician costs. So physician is Part B. Part B is $148.50 a month for last year. We don't know the number for this year, but expect it to go up. If you're high income, you may pay IRMA, which is an adjusted number based on your income. And that would also apply to Part D as well. And that's easy. There are tables out there for you to look at. There's a deductible of $203. And after you reach your deductible, Medicare pays 80% of everything. You pay the other 20. So there's no cap on original Medicare. And original Medicare is referred to as A and B.
Can I just ask
Yes.
a question? I'm confused.
Okay.
So I have Medicare, and then I have Blue Cross Blue Shield and Medigap. When you say Part A, that's regular Medicare, and Part B would be Medix, no?
No, you're a little bit ahead of me. This is original Medicare. You have A and B. Now, when you go and you get your Medix plan, that's supplemental insurance, and I'm going to get to that. You're plugging some of these gaps with that insurance. You can go the Medigap route, you can go Medicare Advantage, and I'm going to cover both of those. So you're on track. And we already determined you're on core, based on what I said. So I'll bring that up when we get to that section. Anybody else questions? How many people here are not retired? 2? Anybody else? Are you not retired?
I'm retired.
You're retired. Okay, so we got 2 that have not yet. By the way, the other group of people who would be appropriate for this discussion would be your children. Because sometimes one of the kids jumps in and helps out mom or dad. And I didn't expect to see anyone here today, but I do get phone calls from the kids too, helping out with some decisions. So, jumping to your question, so how do you plug some of these gaps? 90% of everybody on Medicare has some kind of supplemental insurance. A Medigap plan, and we'll go through that in a second. Medicare Advantage plans, prescription drugs. You need some kind of drug coverage somewhere. Or you may have retiree plans or VA benefits, and those are valid retirement plans and drug plans as well. So here's the average scheme of what someone would have. I'm not showing retiree insurance here. Oh, I don't even know what page I'm on. Do you see this?
Yeah.
Okay, you guys are keeping up? Okay. So the average person would go one of 2 routes. Everybody has A and B. I put D as a standalone because it's required. The supplemental insurance is not, but most people would either go this route or they would go the Medicare Advantage route. In Medicare Advantage is supplemental insurance, it's drug coverage, and there may be a few other bells and whistles like a little bit of dental and vision and hearing. A note, you cannot have Medicare Advantage and a Part D plan. I think the rule probably was put in place that insurance company not drive you to buy insurance you don't need, but you also have to be careful. If you signed up for a Medicare Advantage plan and then jump in and sign up for a drug plan, a Part D plan, you'll get booted off Medicare Advantage. And that was your action that precipitated that to occur.
But don't
all Medicare covered drugs.
Oh,
So what it was, the point with this comment is, if you go this route, you don't need drug coverage because it's embedded in your Medicare Advantage. I'm trying to decide if I want to make another comment or does that add complexity to it?
so that means you need, if you don't go Medicare Advantage, you need to have a supplement and a prescription D plan?
Correct. You got to have drug coverage somewhere. If you're a military, you're a veteran, your Part D plan could be your VA benefits, but somewhere in your portfolio, there's got to be drug coverage. So the question is, where? Okay?
So it's Medigap is one expense on top of Medicare, and then the prescription drug is another.
Yeah, so this, everything up here that's original Medicare. And then the question is, how do you build the rest of the pieces? And what I don't have up here is if anybody has retiree insurance, you would just substitute the bottom half of this for your retiree insurance would be inserted.
So I have the town's retiree insurance, Milford. So is that the Medigap? It's one of their retiree plans?
Do you,
Well, my husband has it.
does your retiree insurance cover drugs?
Yes, it's the GIC plan.
Okay,
For the town, if you don't you can't have one without the other.
okay.
They kick you off it if you cancel their drug plan, they kick you off. You can't have their GIC plan.
So in your case, think of the right-hand side of the screen. You've got A and B, and then what you have for your retiree insurance is the rest of it.
Okay.
I would go, as long as you brought it up, I'll hop on that. For most people, if you mentioned go to somebody else's drug plan or whatever, if you go off of your retiree insurance, you usually can't get back on it.
Right.
That's generally the case. So that would be one thing that we would caution anyone, because some people get to the point, they get a little bit dissatisfied, they don't feel certain things are covered and they feel they should be covered. So they might call up and ask us, they want to do a comparison between their retiree insurance and something else. The first word of caution I would give to anyone is just be careful. If you step off it, you might not be able to get back on it. Okay? Is this clear? This is the source of confusion to an awful lot of people, understanding how all these parts come together. Because you're typically coming from a world where you got one choice on your group insurance. Yes?
I wanted to comment on the left side, you also want to get dental.
None of that is required under Medicare, but we do have senior plans with dental. Is that another question you would ask me about? I got some
No,
information on
I
that.
got Humana dental.
Okay. There are other, if you would, I got some other information over here. Delta Dental and some other things. But that's not required by Medicare. That's incremental.
But it's worth it.
Okay, I thought there was
But
another.
Medicare requires a Medigap and a Part D. It doesn't require it, but it's just that,
Medicare only requires the three.
oh, they do require the Part D. Okay.
They require Part D comes from somewhere.
Oh,
They don't require supplemental, but 90% of the people are on supplemental. They're either on retiree insurance, Medigap, or Medicare Advantage. Because remember, there's no cap on Medicare. If you have, God forbid, a bad year, as you go forward, it's Medicare's going to cover 80%, you're covered the 20%, and there's no cap on what that total out-of-pocket cost could be.
okay, that's what you need, a supplemental.
Okay?
Can you flip back and forth between the two? I thought I read somewhere that if you have a Medicare Advantage plan, sometimes they won't take you back on a Medicare plan?
Medigap, you mean?
A Medicare Advantage plan?
So if you're on a Medicare Advantage plan and you want to come back to here, yeah, you can do that.
Oh,
But again, you got to do it in the right enrollment periods. Medigap plans. how many, if, let's see, not everybody is on Medicare yet, but how many people have Medigap plans here? One?
I don't know what mine's called.
But is it,
The town insurance, the town.
oh, no, okay, no, so you, I would just say for you, you're on retiree plan. It's,
Okay.
it's people,
Either Medigap or Medicare.
it would be modified specifically, you know, to the negotiations of the town or the
So it's a
municipal.
replacement for either Medigap or the supplemental.
Correct. Yours is probably a whole lot closer to Medicare Advantage than it is to Medigap. George, do you know what you have? Oh, yeah, I saw you check it off. You're on a supplemental.
Supplement one.
Supplemental, so you're on bronze. So core, bronze, I'm going to get into that in a second. Anyone else?
Core, thank you.
You're on core?
So the Medigap, you're hospitalized, Medicare pays for 80% of it, and then Medigap picks up the other 20%?
Yeah. I'm going to get into a little bit of detail because I wanted you to make sure that you understand something.
Okay.
And I just was trying to figure out how many other people had Medigap plans. Supplement 1 is bronze. You would have to have been 65 by 1/1/2020. Otherwise, you can't buy that now. Supplement 1A is sapphire, and the only difference between the two is you're responsible for the Part B deductible before everything else gets picked up. You're on core. You are responsible for A and B deductibles, and then everything else kicks in. I don't think I have it in another slide, but remember the A deductible was $14.84? That was on an earlier slide that I showed. So if you wind up in the hospital, you pay the first $14.84, and then they pick it up from there. That's per health event. I don't know exactly the right terminology, but I'm dealing with the lady just in the last couple of weeks. She got hit with $14.84 twice this year. She had some kind of, I don't know what her medical issues are, but early in the year, she had $14.84. She got past that medical event, and that's not the right term. And just recently, she went back into the hospital again with something. She got hit with that $14.84 again. So what she was calling me up and asking me, she goes, get me into something where I don't get hit with $14.84. She was older. She probably saved money along the way, but by the time she was the age she is, she either should have been on bronze or 1A, because that $14.84 would have been picked up in either plan. And this lady, I think, was well into her 80s. You can go to,
I still don't quite understand that bronze and sapphire. I mean,
oh, what is the difference?
yeah, I mean, why, I didn't even know, I mean, I'm just confused about that.
The only difference, basically, if you were on bronze, if you're old enough to get on it, you pay your monthly amount and everything else gets picked up. Supplement 1A, the only difference is that person would be responsible for the first $204. That's the Part B deductible. And then from there, it's the same. Medicare picks up everything. Just one second. One of the reasons why this had to go away, I don't know if that's Congress or Medicare, they wanted people to pay the deductibles. So I think they forced the issue of the bronze plan or plans like it going away. Yes?
Okay, on the on this plans that we're talking, yeah, can you pick your physicians or?
Excellent point. So this really is anybody who takes Medicare you can go to. So I could look at it like you can have self-directed where you want to be cared for. So you can pick any hospital or any doctor that accepts Medicare and is accepting new patients. And I'm going to go into Medicare Advantage. That's different in a minute. So when I talk to people, sometimes I talk to I don't know if they're nurses, they work in the hospital, they have a knowledge of who they want to see and where they want to go for certain things. A Medigap plan is the only logical choice for them. Okay?
So that supplement will automatically pay the missing 20% that Medicare won't, regardless of what Medigap plan it is?
Correct. That's what that's what the word gap is in there. It's plugging those gaps. So it picks up the 20%. Medicare is still only going to pay the 80, but via you engaging with an insurance company, they're picking up the other 20%.
The 100% of the other 20%?
Correct. Other than on the supplement day, you have to cover the first $204. But beyond that, they pick up 100% of the 20, yes.
No matter who you have your coverage with, what insurance plan you have your coverage with?
Correct. And that might be my next slide. This is the only 2022 numbers I have in the presentation. It's the only thing that was finalized. So if you look, let's just look at the core plan. Blue Cross Blue Shield is $113.58. Humana is $192.44. It's the same insurance. The rules are set by Medicare. The insurance companies are simply carrying out the paperwork and so on. So in answer back to your question, you can go anywhere you want, regardless of who you have it, but why would you pay more when you're getting the exact same insurance? And actually, Blue Cross tends to be pretty, at least last year they were, I haven't looked at it closely, but they were pretty much the low cost plan across all of these. Some of the big national ones, Humana, are quite expensive.
Do you have that in a printout?
I do.
Yeah, this is very small.
Oh my gosh, it's not readable.
I need a magnifying glass.
And I apologize for that. I was trying not to cut down a lot of trees. For anyone that wants that, hand it around and I'll just pick up the remainder. And you see up here highlighted in yellow, on the second page, there are certain things like that 1484 that are not covered. That number will be updated. I don't know if it's going to change, but we don't have those numbers yet.
So those aren't the same as what the town? Is the town
So,
in there?
no, it is not. So, we all go to Social Security for A and B.
Yeah.
After that, anything that I'm showing you here, you would approach the insurance company. What you have with the town, that's basically your own plan or the municipality's plan.
Yeah.
So the details of the information you would have to get from the benefits administrator. Okay? So one of the reasons why I'm showing this slide is I'm trying to give people an idea of what everything costs. So what do we know now? We know it's roughly $150 a month for Part B. Then based on one of these three plans, you're either in the $125 range for core, you're closer to $200 for Medigap 1A, and those are additive numbers, okay? Now I'm going to go into Medicare Advantage. They have to include everything that's included in A and B. They must sell you a plan with drug coverage. And I said before, I didn't know if I wanted to say this, so I'm going to leave it at that. They must sell you a plan with drug coverage. You're now in a provider network, so somebody had asked the question, can I go anywhere? In Medicare Advantage, the answer is no. You're buying into their network, so you're more restricted. You're going to pay as you go. There's a copay for everything. Additional benefits may be available like limited vision or dental. They all have out-of-pocket maximums, and that's going to vary by plan. And I'm going to show you one detailed plan just to illustrate the point. every insurance company offers a zero-cost plan. And they tend to offer at least a couple more, something in the mid-$50 range, and then something $100 or more. And we'll see that then the copays and the out-of-pocket maximum are going to change. The more expensive the plan, the copays and out-of-pocket max go down. You're still in the same enrollment periods that I showed you that before. And this is a point that I want to bring up, and I should have brought it up in other places too. Plans change year to year. So there are some Medicare Advantage plans that are going away, and they'll automatically point you to another one of their plans. And you're in it unless you raise your hand and opt for something else. Harvard Pilgrim went away completely. So if any of you are in Harvard Pilgrim, if you don't do something come January 1st, you have no supplemental insurance. Reason I bring this up is a lot of people look at it as junk mail. They never open the mail. They've been informed, but they just never read the thing. So pay attention. Guilty?
Program merged with Tufts. We got something from a Tufts that said they were affiliated with Harvard.
Correct. So what they did is somewhere back in like January, February, they merged. In the way it's coming out at this time of the year, they're going to call themselves, there's a higher level company called, I think it's like 32 point something or other, which is points in a compass. But Harvard Pilgrim Medicare Advantage plans went away completely. They would recommend that you go on one of the Tufts plans. But I would say, buyer beware, pick a plan for the right reasons. So here is, there's nothing magic about this particular plan, but I just wanted to explain some of the things I talked about the cost of the plan and the copays. So this happens to be, for last year, Tufts HMO Basic RX. The maximum out-of-pocket cost is $34.50. The monthly premium is $46, but if you're a low-income person and qualify, it would be $14. They offer drugs. Tier 3 through 5 has a deductible. You pay the first $225, and then the copays kick in. 1s and 2s are excluded from the deductible, and that's pretty common that some part are going to be excluded. You just pay the copay right from the start. Part B drugs, you pay 20%. I don't know if you know what Part B is. Part D is in drugs, tend to be self-administered. Part B is in boy. You tend to go to facilities like a clinic or outpatient at a hospital, and some skilled person like a nurse or a technician is giving you the drugs. And it might be something like chemotherapy would be one example. So there are the copays across the tiers. Your primary care physician, you pay $10, specialist $40, physical and occupational therapy, it's $30 per visit. Then you can pretty much read the rest. The one word of caution that I would have on some of the extras, the dental, the hearing, and so forth, is they're going to direct you either to certain vendors or, like on dental, you might want to check. Does your dentist, if you like to go to your dentist, do they accept that plan? Because otherwise, you might discount the value of the plan with that feature in it because you want to stay with your dentist. I mentioned before there are higher and lower deductibles. If this was 0 deductible, the annual maximum would be higher, and some of the copays across would be higher. Likewise, if it was 100 plus, the out-of-pocket max could be less, but some of the copays would likely be less. So just a way to evaluate the different Medicare Advantage plans. Any questions? You still with me? Yes, George.
This is somewhat complicated to me, and as a veteran, I don't know what my benefits are. Are there services where somebody could review my specific need?
So the only thing that we could do is review if they're sort of out in the public domain. But if you are a veteran and you're entitled to some veteran benefits, you would have to get in contact with Veterans Administration and find out who you can approach to, to evaluate that.
Which
Like,
is just the VA benefits?
correct.
But
Is-
the rest, are there people available to look at my package and say, this is what you should, because
It's overwhelming, yeah. The answer is, if we sit down and have a one-on-one with any sign counsel, we can go through it together and we can raise questions of, are you aware of this and not of that? But ultimately, the decision is yours. Using you as an example with GIC, sometimes people would come to us. It's usually people who are on something already, may be dissatisfied because they thought something should be covered and it wasn't. And I've had somebody through the town said, could I evaluate GIC versus like Medicare Advantage or something else? And the answer is I can't, because I don't see GIC. They would have to do that piece, but I'd be glad to help them compare the two, but they've got to get the GIC information. So here are some of this was just out on the internet, some of the differences between Medigap plans and Medicare Advantage. Typically, it's a higher premium, lower premium on the Medicare Advantage, but you're paying as you go. Freedom to choose any provider that accepts Medicare, and you're restricted to the provider networks in an HMO. No referrals necessary. There may be some referrals. There's some limitations on certain things like skilled nursing facility. There may be a few bells and whistles in Medicare Advantage plan. Coverage anywhere in the United States. I think I mentioned that like a nurse, she wanted to go where she wanted to go. Understandable. The other thing would be if you're a snowbird. If you're out of network with your HMO, the only thing you can do is emergency visits. So if you're going to be getting something monitored on a regular basis, blood work for something, when you're out of network, you really can't do that, or you do it at your expense. So for snowbirds, they typically wouldn't want to go on an HMO.
You know, an Advantage plan.
Yeah, Medicare Advantage and HMO and PPO, yeah. You have to stay within your network, yes. You're right, there's so many common names, I gotta be careful that people understand what I'm referring to. Like there's Medigap and Medex,
What's the difference?
they're the same. It's different lingo that's developed over time,
Just to be confusing.
yeah.
So some Medicare plans cover foreign travel?
Yes.
Do most of them, or?
No, it's usually an additional rider. So so you're not covered on Medicare outside the US. That's the blanket rule, but you can buy a rider for that. Another comment that I've made to some people is you'd pay for that 12 months a year. If you were just going to go plan on taking a 2-week vacation in Italy and hitting museums and such, one way to do that is just buy travel insurance.
Travel insurance.
For a limited period of time, get a bunch of insurance. You can sleep at night and you're not paying for it 12 months a year.
Yeah, why pay for 12 months if you just,
Right.
thanks.
So if we went back to this page here, the supplement
Yes.
plan, and then you would also need a Part D plan
Correct.
in addition to this.
Correct. Unless you have drug coverage somewhere else. How are we doing so far? You keeping up, or am I going too fast or too vague? And that's okay.
I think I understand till you ask me a question.
Yeah, I'm still not sure I understand between the supplemental core and the new Medigap 1A and the difference in the cost. You probably explained that already. I just don't get it.
Oh, there still was one here. Oh, here they are. So for those of you who grabbed one of these, go to page 2. So if you look in the left-hand column, you're looking at what original Medicare covers. So you would have and by the way, these are 2021 numbers, subject to change. But you have a $1,484 deductible for the hospital from days 1 to 60. Then you have $371 per day from days 60 to 61. So this assumes you're in the hospital for a while.
That you have to pay or that they pay?
Original Medicare, you have to pay.
You have to pay.
Then you go to the core. Now you notice as you work your way down in the core, you're only responsible for the first 1484. And then you're fully covered for days 61 to 90, 91 to 150, etc. You go now over to 1A, and all of that's covered. You don't even have the Part A deductible.
So that's basically the difference is just the 1484.
Yes. And then, I'm just dealing with the top part, but there are a few more. Like if you go down to the Part B deductible, you only get that covered on Supplement 1. And Supplement 1 is not available to anybody who turns 65 after January 1st of 2020.
So that's the deductibles, and then on that first page, it shows like which would cost, depending on which one you choose, you have to pay that monthly, like 113 or if you get
Correct.
Medicare.
Correct. So
You have to add up all the different
correct.
pieces, don't you? to figure it out.
That's right.
Yeah, there.
That's how you're starting to put
Right.
together what the cost is.
Oh, okay.
So it's the 148.50 plus an example 113.58,
Right,
plus you still need a drug plan on top of that.
right, okay.
Okay? Oh, so on Part D, if you take a lot of this is very difficult on Part D because there are a lot of elements to it. If you take a lot of drugs, you probably know that you're spending a lot of money. The best way to figure out what the best plan for you, and I know I've got a few sheets filled out, is to go into the Plan Finder tool online. It's at medicare.gov. You can do your own plans. If you can shop online, you can do your own plans. But that's the best way to see. Drugs are in different tiers. Two companies may put the same drug in a different tier. You can buy more. You can buy a lower deductible with a higher premium. But the question is, does that work for you? The best way to do it is to run through the drug finder and look at what the costs of the different plans are and compare them there. Because somebody's done all the work for you. You just have to do the last bit of work. What are your drugs and what are the plans available to you?
So you can have a different insurance company cover your prescription drug versus your supplemental Medigap?
Correct. And there are people that write drug plans in Massachusetts that don't have Medigap coverage here.
But are there some Medigap that do have the drug coverage?
Well, not within the Medigap, but the same company could offer Medigap and drug. Actually, there's one that I've seen on TV. We keep on seeing these athletes show up and do advertisements around Medicare. Joe Montana's on now. Everyone knows him. He's on WellCare. WellCare's been around in Massachusetts for a while for Part D drug plans. They don't do Medigap, but they've just entered Massachusetts for 2022 for Medicare Advantage plans. So I guess we're trying to bet on what other retired athlete might come up with the next plan. Oh, so the reason why I say it's difficult to project what the drug plan is going to cost you. Is there are different premiums, different deductibles? You get into some of the insurance gaps, the donut hole and so on. The best thing to do is to put your drugs in and see what comes out. And it will estimate, based on what you put into it, what your total cost in terms of premium plus drugs. And it will show you a projection of what you're going to pay each month. Because some things are going to be, you'll get a 90-day supply, some a 30-day supply, and so on. These are things to watch out for. Keep track of your dates. Don't wind up in a penalty situation. Don't stay on autopilot for parts C and D. Things are changing, and what may have looked good a few years ago may not be a very good fit now. Don't necessarily buy the same plan as your spouse or your friend. Given the situation they're in, what fits for them may be a poor fit for you. Going out of network on a Medicare Advantage plan, you know, that's going to be on your nickel for other than an emergency. I see this too. People are on COBRA. They got a package deal when the company got bought out or whatever, and they feel that, well, they're covered on insurance, I'm fine. COBRA doesn't count as an active employee, and you could put yourself in a penalty situation. And not contesting income-related adjustments in the year you retire. That's a whole nother discussion. The IRMA would be set for calendar 2021 based on your income tax return in 2019. And if you were working, and your spouse was working, and you were making a pretty good amount of money, you may be subject to an IRMA, but you've just retired this year. You should go in and project what your income will be and appeal to them to either lower the IRMA or reduce it altogether. And if anybody's in that situation, let's talk. It's not that difficult to explain, but it's hard in a bigger group. I said in the abstract, you know, I do something related to what might you qualify for some help. I get two kinds of people that call up and say, do I qualify for Medicaid? Well, Medicaid is not a single thing. There are many different programs. So first of all, it should be a one-on-one discussion. But just to give you an idea, there are plans called things like senior buy-in. It would give you some relief on paying premiums for A and B, deductibles and copays. If you make a little bit more money and don't qualify for that, there's something called Mass Health buy-in, and you'd only get your Part B covered. That's a one-on-one discussion that we should have. We'll qualify. We don't determine who gets the money. The state does. But it's not going to be the panacea, but it might give you breathing room, that plus other programs if you're low income. The final determination is going to be the state. We need to know your gross Social Security. You got to fill out the form, and the state is going to check every number that you put in there, so you got to use the right number. And when I say that, you might be looking at me and say, what do you mean gross? Don't people know that? They don't. A lot of people that have been on Social Security for a while, they know the number that goes into their checking account, but they don't know what the gross number is. They've seen it, but they only saw it once. So they need to, search for their paperwork and come up with that or call Social Security. And we can provide the right application, and we can help fill it out if they need help. And we'd be glad to do that. So with that, I've generally covered the topics that when people call me up, those are the things that they're asking about. Now, I'm sure you folks have different questions and more detailed questions. Yes, sir.
My wife is still working.
Yes.
I'm retired.
Okay.
So we're using her insurance work. She's getting ready to wind down. Is there any reason why we can't? And we are Part A when we were 65.
Okay.
We'd like to go fully on Medicare now. Is there any reason why we can't do it now?
Well, when is she going to retire?
Oh, probably the first of the year.
First of the year? So what I would do if I were you, because we're already November 1st, I would approach Social Security right away and say you want to be on it come the first of the year. So it's good timing.
So is there any reason why we couldn't be on it before she retired? Because I think some other employees there have given up the group insurance to go to Medicare because of certain benefits.
But she's covering both of you.
Yes.
So think about the costs. So right now, you say you're both on A, so she has no HSA, I assume. Health savings account. So by your stare, I know she doesn't have it. So it's costing you whatever her insurance is at her company. As soon as you go on it, both of you will be $148.50 or whatever the new one is going to be, and then whatever else you're going to add to it based on that chart. So you got to add those two together versus what she's paying now. You might be better off just to flip one switch off, meaning when she retires, and then turn on both of your Medicares. I will go one step further. No insurance company can sell you any supplemental insurance or drug plans until they know you're on Part B, and they can check to see that. So you really want to get moving on. They could see an example. If you guys are going to go on Part B in January of next year, you can do all the legwork and they'll flip that on at the same time. Now, you're beyond 65?
Yes.
So you need to fill out that CMS form, or your wife does, to submit it to her employer to show that you've been insured. Is she over 65?
Yes.
She will have to do the same thing for her, so she'll have to submit two forms.
Yeah.
Because effectively, when you go to Social Security, you're just two individuals. You each have to prove that you've been covered. Did I answer your question?
Yeah.
Okay. Yes,
Can we get a copy of this off of the internet?
this presentation,
Yeah,
I can send it to you if you'd like.
oh, that
Oh,
was,
there's a copy there. Did you grab it? That may be small for your,
well, I was thinking of the whole presentation you just put up.
I'd be glad to send it to you. Can you get email?
Oh, yeah, email would be fine.
Did you put that on your drug form?
Yes.
Okay, so I've got your email address. I'd be glad to send it to you.
Because there are some things that I wanted to check. Oh,
Sure. If anybody else wants it, just let me know. I brought with me, I thought somebody who may or may not have come here, I've got some other dental coverage options if anybody wants to look at it. And this is updated. So Delta Dental and some of those things here. I don't have anything on hearing and vision because it's not finalized yet, but we will have that. And if you just make a request, I can send it to you.
So if you went for the supplemental plans, then you have the additional, if you went for the Medigap plan, then you have the supplement plus Part D, plus hearing, plus vision, all added in, that you would have to pay for.
Yeah, so going back to Medicare A and B, it's the hospital and it's the doctors. Any of the other thing, nothing else is under original Medicare. Did you get one?
No.
Oh, you didn't? Okay. Oh, yeah, I'm sorry.
Sorry.
I saw that.
Oh, I know. No, I was just gonna wait. I didn't want to distract things.
Is anybody interested in Medicare Advantage for 2022? And if the answer is no,
Maybe, I'm not sure.
well, I can give you the pricing on that as well.
Oh.
We haven't finalized that. I just realized something. I'm still connected. We haven't finalized all the numbers yet. Only go for one if you're really interested. Interested? George, you?
What is that for?
This is if you want to consider Medicare Advantage. There's been an explosion in the number of companies that are writing Medicare Advantage.
I know, it's crazy.
It's up
There's
like
so many.
40%
But
this
so,
year.
A lot of them have a zero, out of pocket, it's just what you have to pay for Medicare, which is considerably cheaper than the Medigap plan, but it's just that you don't get to choose your doctors necessarily, and it's not covered in every state.
Correct.
Is that right?
It's really in your area.
Right,
So
that's what you're paying for to go to
Who you want to.
the Medigap. It seems like you're safer to go with the Medigap plan, but it's more expensive.
right, but I guess another way that I would look at it, if you don't do a lot of traveling, if you go to Florida for a week, you take your risk and you go to the emergency room if you cut your foot. But if you stay in the area, which their network would be, I think the thing you want to look at is try to project how many times you might go to a specialist or physical therapy and that kind of thing. Make an estimate of what that would all add up to and compare that to other options. A lot of times when people talk to me, they're concerned about, first of all, they want to go to their doctors. So if your primary care physician is in it, that's fine. But if you have other issues and you get escalated up to specialists and hospitals, where do you go? Not everybody has the same network. So let's say if lady here had told me that she had breast cancer and she was going to Beth Israel. So she got into a Medicare Advantage plan where that was an option for her. So she got into one of the Blue Cross Medicare Advantage plans. So she maintained her relationships. Tufts is formerly known as Partners. Now it's Mass General Brigham. So, beyond your primary care physician, you're going to be escalated up into the Mass General Brigham network, with ultimately, you would wind up in the hospitals in Boston or the specialists there. Where I look at this well care with Joe, I shouldn't say this because I have to be neutral, but with Joe Montana, I had to make a quick study of what is their network. And I struggled a bit. I don't know that they have all the pieces in place yet. So I would be cautious, at least the first year, until we get a better understanding what that is. It's probably going to be a great plan, but their website was limited for WellCare, correct. Although I've signed many people up for WellCare drug plans, and those are fine. It's just they're new out of the starting block. Yes?
What's the best way to sign up for Medicare? Just call Social Security and make an appointment?
Yeah, so you got one or two options. You can do it online on ssa.gov, and if you're not comfortable doing that, call Social Security, and you'll wind up making an appointment, and they'll call you back. And be prepared with all your information. It's not that painful, other than the fact that you're hanging on the phone for them to call you back.
And you need to have all your plans picked out by then?
No, the only thing you need with them, remember you're signing up for A and B, and you mentioned you're on A.
Yeah.
So what you're going to be doing is you're going to be settling on Part B. They already know your Medicare number because you've got it on your Medicare card. So it's a relatively minor thing for you to do with them. If you feel you're in the high income category, I'll put that aside for the moment. You would want to be able to get them the CMS forms that prove that you've been covered, because that would avoid a penalty. That's not difficult to do, it's just paperwork. And then what you really want to work on beyond getting that started is you want to figure out the other pieces. And for those other pieces, you are going direct to the insurance companies. There's no retiree insurance in your situation?
No.
So you want to figure out, do I want to go Medigap, Medicare Advantage, etc.? And you go direct to the insurance company for that. And for them to sign you up for the month that you're going to be on Part B is very easy for them. Okay?
The Part B, did they send you a bill? How do you pay them for that monthly 148 or?
So what happens is if you're on Social Security, they'll subtract it from your Social Security check. If you're not on Social Security, they'll bill you quarterly.
Oh,
So they'll get your money.
yeah. I was just curious.
Bill this quarterly, but then start taking it out of the social security
What
check
that-
too, so I have to get it back.
Oh.
Good luck.
Because they took it, I did,
Oh, that's
they
good.
had to,
No, actually, I'm dealing with a lady right now.
they only do it certain times though, they only give it back quarterly, so you have to wait
Yeah.
3 months.
If you, by the way, just to leverage off of what you said, because I'm dealing with somebody now. It's difficult when you call on the phone to get somebody on Social Security. It's the next available person picks up the phone, and it can be difficult to deal with that person on something like trying to understand what months did I paid for. Now you're taking it out.
Well, they sent me some.
You're far better to document all that stuff and do it in writing. I'm dealing with a lady now that she's had family issues and so on, and she's in an emotional period. And at the same time, she was the one that said this, so she said, and I get somebody on the phone that's like, Rosanna Dan, remember from Saturday Night Live? She's getting nowhere, and I'm telling her, document the heck out of everything. And they will deal with it. It may take you a while to become whole again, but that's a better way to do it. But that's not your situation. You have a relatively straightforward situation.
Now, what services do you personally provide?
Unbiased advice.
Okay,
That's really it.
is it free, unbiased?
Yes.
And do you have a card that you're gonna give us, or would you rather not?
Well, first of all, the way to, beg your pardon?
How do we make an appointment with you?
So Linda controls, or,
We have brochures.
oh, okay. And so they control our schedules here. And you can,
We are all full through December, we're calling you now.
oh yeah, and so that's the other thing. Because I know this is open enrollment period. People are crazy busy. But the other thing is you contact them with contact information, and either Jane or I will get back to you. We'll do it over the phone or however you would like.
So I know this is open enrollment for this, but the town makes you decide in May, so if I decide to switch, the town makes us make a decision in, May or June for our insurance? But do I have to, if I'm switching to something outside the town's insurance, do I have to do it now?
Well, I guess, so
Does that make
I think I do understand the question. If you're thinking you would like to do something,
If I want to switch out
For
of the
calendar
retiree
22.
insurance and go to,
well, first of all, if you want to sign up for something new,
Yeah.
now is the time that becomes effective in January. What you're going to have to do is consult with whoever the administrator, is it the town or?
knows, yeah,
Okay, so what you'd have to do is consult with them to understand
if I can.
either when you can or when you pull the plug. You want to avoid having to pay at two places at once. Yes, George.
If you find you want to make a change, are you obligated to go to the existing entity and turn it off? Or?
Usually, when you sign up for something new, you automatically unplug the old.
Okay, so you don't have to.
You don't have to. And again, that could also work dangerously too. If you inadvertently, so if somebody's on Medicare Advantage, if they decided to sign up for Part D, not realizing what the implications are, they inadvertently got off of the Medicare Advantage, which they wanted for the supplement, and now they've only got Part D. So
So you don't have to tell one insurance company, I'm leaving you and I'm switching from an Advantage plan to a Medigap plan?
correct.
They no longer bill you? How do they know?
Well, remember, when you do that sign up, there's an extended period of time before it becomes effective. So exactly the details of how they can communicate and see The reality is they know that. Matter of fact, if I do any of your drug plans, I'll know what you're on. Because that's in your Medicare profile. So they can see too. That may not have been a super direct answer, but it'll automatically unplug you from the last one.
Thank you for your efforts today.
Oh, you're welcome.
Thank you.
I signed up for the November 18th open enrollment talk here, but since I'm not enrolled just yet, is that slot better served by someone who is? Because
So when you say that, that's a Thursday. I assume it's.
well, it's in the newsletter about open enrollment, help fill out that form and bring it. And
If you get us the drug form, the reality is things right now are very busy for the people who are on Medicare and are re-enrolling.
that's why I'm willing to give up that slot.
So what I would do is I would advise Linda, because I think they've got people waitlisted trying to get access to us. Is that a fair statement?
Yes, but we're also having them call you and schedule it separately because we don't have any spots.
So if you freed it up, somebody else would appreciate it if that slot opened
I'll
up.
do that on the way out too, if I have to, yeah, I'll be glad to.
She keeps that on a clipboard.
We do keep it on clipboard, but if you want the spot, it's yours. So,
I can't.
and we're getting other people.
So what she's saying is, you got it, so it's yours. If you're willing to give it up, that's,
I'd rather if someone's already enrolled and needs that time, sure.
What will be covered on November 18th?
no, I think what he's referring to, so,
Individual appointment.
yeah.
Yeah.
So for example, I'm here Thursday, and I'm already signed up. I think Jane is fully scheduled on the 18th, I assume.
It's really for people who are.
Okay, thank you all for attending. I hope you found it worthwhile, and goodbye for now.